Report, the COVID-19 vaccine plan.
Months of waiting, and the race is finally on to vaccinate.
The worry is what is just eats at you. You just never know who's got it.
The massive undertaking statewide and in the St. Louis area to vaccinate as many people as possible.
Hear me when I say that this is a time to consider this vaccine because it is literally a matter of life or death.
The struggle to meet supply with demand, bringing long lines where the vaccine is available and where it isn't available.
Right now, there's nothing we can do. So it's all based on supply.
And the steps state leaders are taking to get more shots into arms now. Good evening, everyone. I'm Dan Gray. This is a Fox 2 special report, the COVID-19 vaccine plan. And we come on the air tonight, we realize Missouri is reporting more than 440,000 cases of coronavirus since the pandemic began and more than 6,200 deaths. In Illinois, a much bleaker situation. More than 1,070,000 cases. More than 18,000 people have lost their lives in Illinois to COVID. There is some great news on the vaccine fight. 3,900 doses of the Pfizer vaccine arrived in St. Louis County today. St. Louis County Executive Dr. Sam Page is joining us with an update on the new shipment and to answer the number one question, how do you register for the vaccine?
You can sign up anywhere to be on a notification list, and that's what our list is. It's a notification list to when you can make an appointment and when you can be eligible. There are 200,000 people who have signed up on the St. Louis County portal, and we just received 3,900 doses today. So we will start working through that list, notifying people that they can make an appointment. But signing up on the list allows us to notify you when you can make an appointment. And the health systems will do the same thing. We ask that you do not make multiple appointments, but you certainly can be on multiple notification lists. At some point, hopefully soon, as we get more vaccines shipped into our region, we'll be able to make more appointments through our health systems, through our county public health department, and through other vaccinators as they come online. As it stands now, we would encourage people to put themselves on notification lists wherever possible, but certainly not to make multiple appointments with health systems, different health systems, or the county public health department. Doing so would keep someone else who really needed the vaccine from getting it.
I asked Dr. Page how long it might take to vaccinate those through the Phase 1B group of those over 65 and at high risk before moving on to other members of the public.
Well, there's probably a couple 100,000 people in that group. That's a big group in St. Louis County, but we don't know how long it will take to get all of those folks vaccinated. It depends on how quickly we can get vaccine into our community. We're setting up mass vaccination opportunities across the county. We'll be partnering with different agencies, vaccinators as well. This whole process is pretty fluid, but this week we are trying to get a mass vaccination location identified. The first mass vaccination location will be in North County. We'll be working in cooperation with our health systems. We'll be doing a lot of the heavy lifting on vaccines along with the St. Louis County Public Health Department. And then we're looking and identifying and partnering with other vaccinating groups in the county. We'll make all of those locations and opportunities known. So as we move through this, folks will have the opportunity to get a vaccine closer to home.
And Dr. Page is asking everyone to avoid trying to jump ahead in line to get the vaccinations.
Well, we need folks to follow the public health guidelines, the directives from the state, the directives from the CDC. It's very important that people who are highest risk for exposure and highest risk to become severely ill from COVID have access to the vaccine first. And really does require people in our community to think about their neighbors, think about how this COVID has impacted our community, and follow our CDC and public health guidelines.
Now, we are scrolling on the bottom of your screen the number to call tomorrow morning if you do not have a computer to sign up for the vaccine online. In St. Louis County, the number is 314-615-2660. 314-615-2660. Fox News' Vic Faust talked now with the Missouri top doctor about how many vaccines the state has given out and the timeline for thousands more to arrive.
First question, Dr. Randall Williams. How much vaccine is actually available in Missouri and specifically St. Louis?
Right now, we're receiving approximately about 80,000 vaccines a week. We're in a universe, 1A was about 500,000 people, which was around 150,000 long-term care facility residents and staff. We immediately gave to the federal government to use with CVS and Walgreens and other independent pharmacies enough vaccine to vaccinate everybody in a nursing home in Missouri. All 1,300 signed up. Incredibly appreciative of that. Tier 2 starts today. Is everybody over 65 and anybody of any age with certain health conditions largely defined by the CDC, such as cancer, heart disease, pregnancy, Down syndrome. Tier 2 of phase 1B, that's almost 2 million people. We have 1 million Missourians who are over 65 in a state of 6.1 million people. And so you can understand that when you're getting about 80,000 vaccines a week and you've opened it up to a universe of about 2 to 2.5 million people, that not everybody, even though they've been prioritized by the state, is going to get their vaccine immediately. It will take weeks to get through that. We have now sent vaccine to all of our 50 largest healthcare systems in Missouri. And now we are moving through the next 50 to reach 100 of our healthcare systems.
We have a viewer question. Donna in St. Charles says, my husband and I registered for the COVID-19 vaccine. Our classification is 1B Tier 2. How do we know when and where to get the shots?
Well, again, realizing that in a universe of almost 2.5 million people, getting 70,000 vaccines a week, 80,000, that not everybody who's in that tier, even though they've been prioritized, is going to get it. We know that. That's just simple math. So what we encourage people to do is on Friday, we posted all 333 vaccinators, systems that have signed up to vaccinate, SSM, Barnes Jewish, health departments, FQHCs, private doctor's offices. Go to that website, mostopscovid.com, see in your community who has signed up to give the vaccine, and then contact them to find out if they have it, when they expect to get it, who they're vaccinating, and how and when you make an appointment.
How soon do you think we could move from the 1B Tier 3 group, other essential workers, in this group like teachers?
Yeah. So our hope is, we were on a phone call with General Perna on Thursday, that the J&J vaccine will come on board in March. The AstraZeneca vaccine's already been approved in the UK. We're hoping it will come on board in late March, giving us 4 vaccines in Missouri, but not again knowing how much we'll get. So our hope would be that at 80,000 a week or so, we would hope to move through phase 1B and the 2.5 million now by mid-April, late March, somewhere there, and vaccinate everybody in that phase, then move into phase 2 and 3, such that we'll probably move into phase 2 and 3 in mid-April or so, and be finished that everybody in Missouri who would want a vaccine should have been able to receive it by July, according to Dr. Fauci and Dr. Slowey and Dr. Perna.
Another viewer question. Troy in Kirkwood says, why haven't hairdressers and other salon employees been included on the essential workers list to get the vaccines? And when will they? One thing it's always important to remember is if you haven't received the vaccine, or if you haven't been prioritized, it doesn't, is not a reflection on your contagiousness or your value. It is really about protecting our most vulnerable who would be at risk should they get COVID from getting very sick. And we don't have evidence that hairdressers
are in a special category that if they got COVID, they would become more sick, like someone who is 65 or has cancer or is pregnant.
Back to you, Dan.
Well, you can register to get a vaccine through your local health department or healthcare system. In the St. Louis area, 4 major healthcare systems, BJC, SSM Health, Mercy Healthcare, and St. Luke's Hospital. You can find those links on fox2now.com. There you can also find all the information we're sharing with you over the next 20 minutes. Just scroll down to the featured section on the homepage. Next on the COVID-19 vaccine plan, once more, vaccine doses arriving. Many communities also planning to ramp up distribution sites. Coming up, the big site planned in Illinois and one operating now in St. Charles.